All right, thank you, Mike. Joining us now on set, Dr. Roscoe Nelson from Arizona State Urology.
What's the website?
Yeah, this is good.
pdoc.com.
He's a urologist.
You got to have a sense of humor with
You
this
have
field.
to.
It's very good. pdoc.com. All right, Dr. Nelson, when is it time to see the urologist? That's just a comment.
He's a young man.
When is it time to go see your urologist?
He's asking for him.
We see patients of every age. We see young men for vasectomies. We see a lot of people for kidney stones. But for what you're asking about is your prostate check. And the answer is about 45 to 50, depending on your race, your family risk, your family history.
Right. So for people who just hear those words, the prostate check, a lot of guys, when they don't know about it, can you just explain what it is?
I'm already,
yeah.
We're checking for prostate cancer. Prostate cancer is the #2 cancer killer of men in America. And it's a two-part check. It's a blood test and it's a digital rectal exam. That's the part guys don't want to do, but it's 5 seconds.
It's
fast. Quick.
I've done it.
Yeah, and
Not
it's important.
You're going to coach me into it. Okay.
Yeah. It is so important. We've
really
cut the mortality rate of prostate cancer in half in the U.S. We're down 48% since we started checking PSAs and doing exams.
So important to get that screen. And I'm sorry, the age one more time.
So I'd start at 45, 40 if you're African American or if you have a high risk, high family risk.
And are there any symptoms I may be looking for that may indicate that I do need to come in earlier?
You know, if you're having symptoms, if you have blood in the urine, if you're having a lot of obstructive symptoms, difficult time urinating, you need to come in earlier. That's typically not from prostate cancer. That can be from something else that needs to get checked out.
Some sort of infection or something like that?
It could be infection, could be a large prostate, could be a stone, and there are other cancers, kidney cancers, bladder cancers that can present with urologic symptoms.
And this is just me, and for some, I have this, this idea that the urologist is for women only, or it's for men only, but it's not.
Yeah, I've heard it's the male gynecologist, but it's not. 40% of my practice is with women. The PDOC, really, we deal with incontinence, we deal with kidney stones, kidney cancers, bladder cancers, all aspects of the male genital urinary system and the female urinary system.
And kidney stones are probably a big problem here in Arizona, correct?
Huge problem. I had one. It's the worst pain of my life. When I talk to women that have had children, they always say the stone hurts worse.
Really? And so how do you screen for that? I mean, is it just pain when someone has a pain and they come in and they say, I think I have kidney stones?
Yeah, typically it's flank pain or blood in the urine. The most important thing they can do, though, in Arizona is stay hydrated. We have hot, dry winters, hot, dry summers. They need to drink more. Add a little lemon to their drink. That often helps absorb some of the calcium.
And my wife had to battle kidney stones immediately after pregnancy. And is that something that you see commonly?
The #1 risk factor for women is pregnancy. They have higher urinary calcium rates, and so they need even more reason to drink more and add that lemon to their drink.
And is there a danger associated with this beyond just the stone? Something major effect it could
Aside
have?
from the horrible pain?
Aside from the horrible pain, yes. Yeah. That I'm sorry you had to go through, it sounds like.
Yeah, mine only took about 8 hours to pass. But if a stone doesn't pass and it's causing obstruction, after several weeks to months, the kidney starts to die. And I unfortunately see patients with old stones with dead kidneys occasionally.
Dr. Roscoe Nelson, say the website again?
pdoc.com, PEDOC.com. Great, thanks.
Thank you so much for joining us.
It's been a pleasure.
Appreciate it, all the helpful information.
Thank you very much.